Hello. I am sure that I might be missing some folks because I've been having a time with YouTube. But thank you for those that are going to catch me live. If you don't, this will definitely be available here on this channel, and I will definitely share it in my group about the stem cell introduction. I apologize for my delay. I've been ready to go for the last 45 minutes, and I guess just everybody right now is going live on YouTube. But welcome and thank you. This is my first video here on YouTube on my channel. My name is Dr. Brandy Brown. I'm a family nurse practitioner, mentor. Also, I do a lot of precepting. I also help to get others positions as NPs as I can. I also do site evaluations, as well as I also have a workshop called NP Real World Survival Workshop, and it is something like no other. No one can duplicate this at this point, but it gives you a whole roadmap into becoming a nurse practitioner in the real world, no matter where you are in your career, because many people that have been nurse practitioners have been in the same spot for years and years and years and have no clue how to maneuver themselves outside of that one place that they've ever been, as well as we have new grads who have no clue where to start. And we have those that may be still fresh in their practice and really need mentoring, guidance, and how to move forward. And I also, in that same workshop, as well as separately, I do consulting to help with people, nurse practitioners that are looking to start their own practice and their own business, or even just becoming independent contractors. So that's just a little about me. So this particular video is about stem cells, and I wanted to start bringing in different videos on different topics in regarding your practice and how you can enhance it, as well as there will be videos on being a business owner, as well as how to get your career jump started as a nurse practitioner. So feel free to leave a message for me. Let me know topics you may want to hear about at some point in time, but you can also email me as well. And if you are on Facebook, definitely join our group and try to be a part of it and keep the conversation going. We have to help each other. We have to work with each other. We have to help each other grow. We can't steal from each other. We can't tear each other down, but we can definitely help each other grow. So definitely, I'm loving to share this information with you. It's important that I try to help grow as many nurse practitioners as I can, because that is part of what my job here in this world is to help others. So let's just get started. So the first part of this is just really going to go over a little bit about what a stem cell is, as well as the certain types that are being used commonly now for general medicine, as well as aesthetics. And I mean general medicine in the sense of general chronic illnesses that people are suffering from. So if you don't already know, or you've forgotten as a nurse, what a stem cell is, it's basically a cell in our body that can become, that's either derived from a particular organ or particular area of the body that can replicate into that particular cell for that organ or that particular area of the body. Then you have different cells, different stem cells that come from places from younger, or how do I want to say this, from other areas of the body that can become any cell. So, and I say that to say that because there is a difference in those stem cells, and we're trying to utilize a lot more of these stem cells that can basically replicate into any cell in the body whatsoever. And some of those cells are going to include, and I did make notes because I tend to just talk and I end up forgetting topics that I really want to cover. Most of it's all sitting here, but the main stem cells we're going to just kind of go over and talk about are going to be the amniotic stem cells. You have umbilical cord stem cells. You have adipose stem cells. And of course, we have embryonic / Wharton's jelly stem cells. And those are all the human stem cells. And then you also, again, you have plant stem cells that they are starting to utilize a lot more with aesthetics. So you will see a lot of products. Actually, I've been working on a product as well for skincare that will have a particular plant stem cells in it that they find helps to regenerate the epidermis layer of the skin all the way down to the part of the epidermis layer as far as regenerating the epidermis stem cells. I'm sorry. So one thing that people will hear a lot about, and people have asked me about when I talk about stem cells, is they're talking about getting those stem cells taken from them. And that's usually done now outside of the bone marrow scenario. The other one that's done kind of outpatient wise in some clinics is called adipose stem cell. And basically, they take the stem cell from that particular person. They take it from the actual adipose tissue, and they spin things down and take out what they need to get to the actual stem cell of that adipose tissue. And then they take it and they re-inject it into the site that the patient needs that to be injected to. Couple of problems. The first one is that procedure hurts like heck. Okay. I don't think if your patient's already there, especially for chronic illness, that's not something you really want to do. Secondly, another issue with that one is the stem cells that we take from our patients, especially if they're actually like older, 40, 50, 60, the cells are not the same. The cells are not going to regenerate the same. The cells are not as healthy. And it also depends on the person's health. If they don't have really good health, especially like someone with diabetes, those fat cells are not going to be very healthy. So they're not going to do what we want them to do. And the procedure is kind of like a mini lipo. So, the patient ends up having a lot more problems related to that versus doing it in a different manner or using a different technique. So again, the adipose stem cell is a very good stem cell. Actually, is very rich in certain things and is very good for healing, but it also starts to decline in cytokines, growth factors, as well as proteins because of the age of it. So, but it does have a high concentration of actual stem cells. If you were to actually look at them under a microscope, they have a lot. There's a whole lot sitting there, But again, the other options will have just the same. And we'll get to why that can possibly happen as well. So let's talk a little bit about amniotic stem cells. Okay. So one of the good things about amniotic stem cells is they are hematologic as well as tissue based stem cells, meaning that they can replicate blood cells as well as tissues, organs, cartilage, muscle. And they have strong growth factors that help to regenerate these things, as well as they have increased cytokines. So it really helps with inflammation, pain. It's great. It's usually gathered by mothers who are getting amniocentesis. It is tested in an FDA-approved lab. And at the end of the day, it doesn't really have anything ethical about it, arguments. But people still argue the point. But most people that donate those stem cells know why they're donating it. And they have been screened themselves to be sure that they are great candidates for it. So it's not providing more issues to the person that it's donated to. But of course, it has, again, great for pain reduction, great for reduction of site inflammation, has a large amount of growth factors in it, and it's great for tissue remodeling. So it's really going to help change that particular area depending on its concentration, of course. So now we're going to come down to, you have the umbilical stem cells, which are sometimes clumped together with the Wharton's jelly. As we know, the Wharton's jelly is a jelly that's part of that umbilical cord area where we're snipping off and have your vein and your arteries there. So what's so great about these, right? Well, the umbilical itself is very high in concentration of all the things that the amniotic stem cells already have. They're at even higher concentration. And they have all of the same factors. But one of the great things about it, because of how nutriented, I don't even know if that's a word, or how nutritious it is, it can double much faster in its replications. So a lot of times you will see a higher concentration when you order these types of stem cells for your patient, along with Wharton's jelly, very high in the actual concentration. And that's what you want to make sure that you check for. It also increases bone growth. So a lot of people who have issues with chronic pain that have to do with musculoskeletal, great option. I mean, awesome option. And the umbilical cord, yes, can generate blood cells as well as tissue, muscle, cartilage, and organs. Now, Wharton's jelly does not do blood cells. However, it is, again, great for tissues, organs, even cardiac muscle, nerve reconstruction, cartilage, as well as muscle. So knowing what each of these types of stem cells can really regenerate and fix is also how you will decide which one you will actually need to order, and based on what your patient's needs are. So you're definitely going to pick something that has a well-rounded option of things that it can help to, of conditions it can help to actually fix, right? And again, both of them help to regenerate the body itself, of course. And one of the great things I want to say about the stem cells that are from basically embryo, amniotic, or umbilical, or whatever the case may be, there's a less of a chance of rejection. Some have argued this point, but I truly believe it's less, because if it can become any cell, that means that it has no reason to necessarily the body for it to reject those cells to actually give you the effect that you're trying to get from it, because it can adapt to the environment that it's in, which is why a lot of times they will use the adipose stem cells, because it's the person's own body, so they don't have to worry about it, their body reacting differently. But I think when it comes to maybe organ transplants and so forth, those are things that you may have to look at it more deeply. But when you're treating simple things, more superficial things, I think that it's possible that you can get away with these options. So the last one I want to talk about, of course, as far as human, is the embryonic, which is one that is very controversial. And that's because of how it's actually collected. And the embryonic is usually collected from embryos that are not actually used, So, instead of people getting rid of those embryos that were fertilized, they try to utilize those embryos for research and for stem cell and to go back to healing people. And I mean, it really just depends on where you are on the ethical factor as far as how that is an issue for you. But ultimately, it's a really great option. And it's one of the even better options of all of them. However, in my professional opinion, the umbilical or with the Wharton's jelly would probably be your next best option if you couldn't use the embryonic or you had issues against that. Even the not the embryonic, but the Wharton's jelly, as well as the umbilical, are being utilized even with diabetes and trying to facilitate how to better encapsulate the whole insulin issue that many have as their problem with the insulin cells that, most diabetics have a problem with. So there's a lot that's like kind of coming into fruition when it comes to the stem cell. A lot of it is still experimental, but it's not to say that it doesn't work. Everything is done through an FDA approved lab. So there's ethical things that are taken care of, laws that can't be broken, testing that is done. Testing from diseases to anything that might change DNA wise that might be abnormal. Like all of those things are checked to be sure that what is being given out to the public is, appropriate. So everything is still experimental, but what isn't experimental? We're all kind of experimenting. But it is a great option because many people come and utilize stem cell for chronic pain and chronic joint pain, chronic nerve pain. That is one of the biggest reasons why many use stem cell. And you're going to have patients that are going to come to you for that. Many of them are trying to avoid surgery. They're trying to do anything they can away from having to worry about getting under the knife, which definitely costs more money and definitely makes the recovery for them very hard, especially if there's someone that is, has a high chance of being stuck in the hospital because they're too old, they're older and they have a lot of other comorbidities. Or you have younger people who know that, I'm going to have to be off of work for 3 months, if I do this, but if I can avoid it, I would love to do this, Stem cell can also help with joints that, are missing cartilage, that are missing lubrication. It can help all of those things. And it's a simple joint injection. You can do it under ultrasound or you can do it without. It depends on how great you are with that. It's an easy learn. You don't have to spend thousands of dollars. It's an easy learn. Most of the stem cells come in a little vial from certain labs. And usually what you want to make sure that you see is a viability report. And that viability report tells you how many actual stem cells are in that one vial. They come from a 0.5 cc to 1 cc, I believe up to 2 cc's. I think anything bigger than that, some may do, but the price starts getting higher. And the prices are anywhere from about, I want to say 900 to about 3,000 a vial. And you want to see that viability report. You want to be sure that you see more testing. You want to see all the testing that's done. You want to make sure that there's more live cells than dead cells because it's inevitable that there may be some that may die off in the process of getting those stem cells to the provider. But they must be kept frozen. So many of them will send it to you like for next day use so they can be used within 24 hours, or they'll send it in one of those cryo freezer thingies that you're going to keep your stem cells in to keep them at a certain temperature. So it's a very little vial with very little bit of stem cells, but they work awesome. I've had great outcomes with many people regarding them, but I've also added some other things to my actual practice and regimen for my patients that utilize the stem cells to make it happen even faster and to get even better results. So that's something I'll discuss at a later time because we're just going to kind of keep this, still an intro. So you want to make sure you have a viability report that will show you again how many cells you actually have, which is important, how many actual live cells you have versus dead, and as well as what testing was actually done. So you should see like if syphilis, HIV, not AIDS, hepatitis, so forth was tested and what it came back to be. So you want to make sure you have that. You want to make sure it's available to the patient. You want to make sure the patient can even call the lab and ask them questions if they choose to, because this is a big step. Because ultimately you can charge anywhere from $3,000 to $8,000 per treatment. And most patients will need at least 2 treatments. I had a chiropractor at one point who thought it was just one time, but that's not true. They'll probably need at least 2 treatments, and you'll probably want to keep them at least 6 to 8 weeks apart, but it's a great option. They do all the healing factors for that joint, for that area. You can use it for stem cell for hair. Stem cell can be used to help regenerate the hair as well as skin. It is great for skin as well. It can help regenerate those epithelial stem cells. It can help to regenerate so that you have less wrinkles, that it brightens up your skin, that it keeps your skin smooth. The whole purpose of it is that these cells can turn into any cell in the body, pretty much. That's why it's important to pick the right stem cell, because you want it to do exactly that. You want it to change into anything and everything that you're trying to treat. We even use it, many people are using it now, or practitioners, doctors are even using it during surgeries, as part of the way that they heal, with wounds, with, oh goodness, I'm sorry, with wounds, with, in general, just internally, if they have organs or something that they've actually had to do some repair to, they utilize that along with the PRP, which will be the next video. So again, it's experimental on some level, but is it really? Because if you have good patient outcomes and you've come up with the regimen and you're using it the way it's supposed to be used, it's not really experimental, because if you get the feedback, you're doing awesome. You're getting what the results that people are looking for. Wharton's jelly has also been utilized to find out that it actually repairs endometrial damage. So what is that to say to somebody who's doing women's health and helping their patients be a part of that type of a research? Like, how can I regenerate my epithelial, I can't talk today, my epidermis level, my endometrius cells? How can I fix that? That's like telling a woman that, guess what? There's a chance you could heal that area, have less pain, have chances of having a baby easier, and so forth. Like, these are experiments that are out there. These are things that are being utilized, and soon it will be more than just pain and skin, which is what most of it is being used for currently, and hair. It will become something more. So there is, again, although it's experimental, it is definitely becoming something that is utilized more and more. Last but not least, plant stem cell, which is used now in a lot of organic and all natural makeup, as well as skin products. And the main actual plant or fruit that is being utilized is apples, because it seems to have a better shelf life. But those stem cells work similar to those of our body, because they are a living cell just like we are. So it can help regenerate the epidermis layer of the skin. So it's going to give those same glowing effects that some other creams may give, that have a lot more toxic ingredients to it. And people who want to stay more natural, utilize natural products, avoid allergic reactions, this will be an option for them. So you can research more on the actual stem cell of the plant in skincare products if you plan to get into more of the aesthetics, as you go through looking for different markets that are going to supply you with those things. Or even if you go into private label, like I will be, for certain items, that will help regenerate the skin. But again, stem cell itself is a great option. It has great use for you and your patients. And most of these cells are I can't even say the word. Basically has multiple uses. I believe the Wharton's jelly is one of the ones that's more of a multi-use, and the amniotic, they're like multi, because they don't do everything, versus the umbilical, which does. I'm sorry, not the amniotic, but the adipose. And then you have some that are that are plural stem cells that change into any and everything, that they have now become, they have some that are called induced plural ones. And I think they're taking those from the actual adipose stem cells and trying to do that. But that's scientifically, genetically being altered. We don't want that. If you want to do something natural, utilize the natural options that don't need all that. It's just a matter of cleansing and testing, and it can be ready to be injected. The younger and the newer the cells are, the better results that you're going to get. Many professionals are using it, and not just chiropractors, but you have actual medical professionals that are using it in their practice because they believe in it and they've seen true outcomes that have been greater than not using it, and have seen things that have become better with utilizing it.
Tell me your voice password.
So,
Continue.
I apologize, everyone. So this is my intro into stem cells. I hope it was informational. Again, I will try to keep digging in deeper and deeper as I can into this. I won't go too deep because, of course, I encourage you as nurse practitioners to up your game and do research so you could be just as knowledgeable as I have been in my practice in utilizing this. At some point, hopefully I can do a actual video with me doing the stem cell, but again, we'll have to get patient consent. But those that deal with me as far as precepting, or those nurse practitioners that come and shadow me or hang out with me, or even that I mentor or consult at times, they do come and see me do those things when I am doing them at different offices, as well as when I'm able to do it at my own, and see how this process actually works. But the next video will be on, of course, another 1 to 2 weeks from now, but I'll definitely be doing the PRP. And I will tell you a little bit more about how the stem cells and the PRP differentiate as well as work together. And also, one thing that I would like for you guys to be aware of when it comes to stem cells is it is a healer all on its own, meaning your patient should not be on any anti-inflammatories prior to taking this, or blood thinners. You need to make sure that they are off of it at least 3 days prior to a procedure with you. Okay. We know why the blood thinners, but the anti-inflammatories, it's because you don't need an artificial anti-inflammatory. That is what the stem cells do. You will then start having the body start interacting with something else that it shouldn't be, and you won't get the same results. And using heat and ice in that section will be helpful to that patient as they heal, as well as using, I wouldn't even suggest Tylenol, honestly. I would use just the heat and the ice. And then, as they progress, after about a weekend, maybe 2, if they wanted to use something more natural, like maybe an essential oil to rub on them, like a lavender or a peppermint or something like that, that will help, or a wintergreen that will help with the, discomfort, great. Even a TENS unit, I give those to my patients all the time. The TENS unit is a great option as well. And it just kind of helps shake it all in there. You know what I'm saying? And then, of course, I would still try to keep them from using it even afterwards, because that's its job. You really are not supposed to have any anti-inflammatories for up to anywhere to 2 to 4 weeks after the procedure. So, if you can try to keep them away from it for a good extended period so they can get the most out of it, that would be great. Many of them will see more of a change around 2 to 4 weeks. They'll see a great deal. And then closer to 6 to 8, they'll notice even more. But it's a continuous thing. It doesn't just stop. That's one of the great things between PRP and stem cell. It's not something they have to keep doing over and over and over again. Some people may once a year want to get a little boost of this, that, and the other. But ultimately, after those few sessions, it is supposed to be a permanent fix for them, as optimal as it's going to possibly get. So you want to encourage people that when they are spending the money on this, that it is an investment for permanent results, and results that will hopefully keep them from surgery and or having to worry about the recovery of being under a surgery, at least for joint and chronic pain. And as we know, hips and backs should be definitely done under some type of fluoroscopy. And you may not do the back stuff. You could probably get away with some hips depending on your area of expertise. But honestly, knowing just how to do joint injections into those different joints is really all you need to know as far as being able to give stem cells for that reason. Again, chronic pain, joint pain, for knee pain, helping to regenerate cartilage, joint juice. I can't think this evening. My medical brain is gone. for elbows, wrists. I've even done for plantar fasciitis. That one was a biggie, and it was for a nurse, and she took it, but it was hurtful. Necks, shoulders, like you can do it for pretty much anything. And again, skin wise, you can do it for anywhere on the skin. You have needles that you can utilize that for. You can use it for lifts. You have your Pro Cell needles, you have your pin needles for skin and for hair. You also have for, if you want to do more of like, it doesn't have to necessarily be like a filler per se. It could just be the actual treatment. They also have mesotherapy machines that have the actual needle and help to actually help the application of putting these products such as stem cell, like near the eye area, in the face, in the forehead, but it gives a more precision of a result if you're trying to get very specific results versus using a pen where you're just kind of doing a generalization of the skin. If you're trying to get certain sections, the mesotherapy gun is an option, and it's a great option. It's used for Botox, it's used for stem cells, used for PRP. But again, I don't really feel most people need the Botox, especially, I want to say, darker skinned people. And I don't mean necessarily Black people. I mean just darker skins as tones. You can get away with using the stem cell or the PRP to help regenerate things that you are trying to actually fix, especially if you have pretty good skin, like you've not been a smoker most of the time, you have a good skin regimen, you don't drink a lot, you haven't done drugs or things that would cause your skin to be worse off than what it really would be, as you age. Now, if you've been really hard on your skin, or your skin has just had a hard life, because it happens, then yes, I would say, hey, go ahead, throw some fillers in there along with this. But this is a long-term treatment. So I would always still encourage people to still try these things out, because even when the Botox wears off in a few months, this will continue to still be regenerating, still multiplying cells. Like, it just doesn't go away. So that is my intro into stem cell. I hope that you all enjoy this and that it was very informational for you. If you have additional questions, I will definitely check comments. If you are in the group, you are welcome to post comments there as well. I will definitely be back with another video for you all. And if I can go into specifics for you, I can do a follow-up to this video to try to answer certain viewers' questions. But I hope this helps. And I encourage you as a nurse practitioner to grow yourself, grow your practice. It's not just about who can tell you how to get a job and, telling you how to get a couple of things to get you started. Knowing how to do very specific things, knowing where to go for these resources, knowing how to use them to your benefit is what's going to help you grow in your practice and make you successful. And that is why I'm here. As I say, I have the secret, but you have to follow the rules. No, I'm just kidding. No, really, seriously, knowing how to grow yourself as a nurse practitioner will only help you grow and become even more of a greater asset to your patients as well as to the medical community. There's plenty of patients out there. There's plenty of information out there. Use it to your benefit. Definitely. Well, thank you all. Thank you. Again, I'm Dr. Brandy Brown, family nurse practitioner, who is here again to help you grow, learn as much as I can possibly teach you, and give whatever advice, any mentoring, consulting that I can give. And please sign up for the next course that is coming up in March. I promise you it will not be a waste of your time. And it is a networking option as well. See you soon. Thank you.